One of the first things that I tend to release on the body is going to be the quads. Here's the reason why. So the quads, as you can see on Walter, they start from the knee and they go up into the front side of the hip right here in this area. So a lot of the time these muscles will get overly tight, and that leads to this femur bone, which is this bone, to kind of get jammed into the hip socket there. What I've noticed over the years is a lot of the times the hip flexors with the quad muscle will cause the hip to kind of get short in the front and tight and restricted, because it crosses the hip joint and it connects into this bony part here. It'll push this hip bone slightly back into the socket, causing the hip to fall forward over it, creating a lot of tension and pulling and compression of the low back. So I want to first release the muscles of the quads here, right here in the quads. That's going to allow your hips to fall forward and stay more upright, reducing the tension on the back of the hips here, as well as once we release this muscle, we'll go into releasing the hip flexor, which allows that hip to fall back a little bit more naturally into the posterior position. So if you guys have any low back tightness, hip issues, I'd recommend you go ahead and releasing your quad if you can. Sit on a foam roll if you can for about 2 to 3 minutes, laying face down. If not, if you want something that goes deeper into the quad, go ahead and lay on a medicine ball. That's gonna definitely get into the tissues, hydrate the fascia, make that muscle nice and soft and pliable.